Before you can say you are infertile, before you can say you have problem in conceiving, you should first ask yourself these questions. Let me tell you what infertility means. Infertility simply means unable to get pregnant despite having carefully timed unprotected sexual intercourse for 1 year. That is the meaning of infertility. It means having carefully timed unprotected sexual intercourse for 1 year. I emphasize on carefully timed unprotected sex because some women have sex at the wrong time. The wrong time means, do you know your ovulation and do you have sex around this period? Because that is your most fertile period of the month and that is the time you need sex the most. So those are your right time of having sex. If you're having sex every other day, that is not your ovulation day, it might be difficult for you to get pregnant. That is why I emphasized on carefully timed. The unprotected sex, it means that are you on any form of protection or contraception, because this can hinder your chances of getting pregnant too. Before we proceed in today's topic, let me welcome you back to my channel. If this is your first time here, you are the right place. Kindly hit the subscribe button and turn on the post notification so you always get notified anytime I post a new content. For my returning subscribers, thank you so much guys. I love you all. Today, I'll be asking you questions, indirectly telling you the necessary tests that needs to be done when you're trying to get pregnant. And the first one is, do you have regular unprotected sex? Yes, when you're trying to conceive, you should have regular unprotected sex. The regular unprotected sex, it means that do you have sex at least 3 times in a week without condoms and without contraception? Can you say that you have sex minimum of 3 times in the week for a period of 1 year? So before you jump into the conclusion that you have infertility issues, ask yourself these questions or check yourself. Number 2, have you done fertility hormone blood test? This is to check the level of your hormones like AMH, anti-Mullerian hormone, prolactin, progesterone, estrogen, follicle stimulating hormone, luteinizing hormone. Have you checked these hormones to make sure they are within their normal range? Number 3, have you done pelvic examination? Number 4, have you done ultrasound scan to know the structural causes of infertility? Number 5, have you done male fertility test? Has your partner done sperm analysis and has he done hormone testing as well to check the level of the hormones like follicle stimulating hormones, luteinizing hormones, testosterone, and so on? Has your partner done hormone testing and also sperm analysis? Because if you are okay and your partner is not, for instance, is having a low sperm count, it might be difficult for you to get pregnant. So do not jump into conclusion that you have infertility issues if you have not undergone all these tests. Number 6, do you menstruate regularly and do you ovulate regularly? Because some women menstruate and does not ovulate. I have a video on the causes of menstruating without ovulation. It is called anovulation. Women who menstruate and does not ovulate. I have a video on the causes of this anovulation. The link is going to be in the description box. Do check it out. Back to the topic. Do you have regular menstruation and do you have regular ovulation? Number 7, which is the last one, is, are you more than 35 years of age? Because age can affect a woman's fertility too. If you are above 35 years of age and you have problem in getting pregnant, do consider fertility hormone testing or fertility test after 6 months of trying. So before you crucify yourself, before you say you are infertile, you should be able to put answers to these questions. Once again, do you have regular sex? Have you done fertility hormone testing? Have you done pelvic examination? Have you done male fertility testing? Have you done ultrasound examinations? Do you have regular menstruation and ovulation? And the last one, which is number 7, is are you over 35 years of age? These are the questions you should ask yourself, and also the test that you should do if you're trying to get pregnant. Thank you so much for staying with me to the end of this video. If you find it very helpful, please subscribe to my channel, like, share, and drop your comments below. Turn on your post notification as well, so you always get notified anytime I post an educative content here. I will see you guys in the next one. Thank you.